Yeah, thank you very much. Thanks, Lorio, at organizing this event. And we're very thankful that we can be here and that I can give you some real-life use cases at the moment on IoT. We have taken a topic that might be a bit different from the speakers before, but that we think has a lot of impact on IoT. This is how we perceive IoT in healthcare, or this is what you're going to see in the advertisements. Robotics, Da Vinci robots operating people miles away. That's the expectation we have, and unfortunately, that's not how we perceive the market at the moment, at least. Up there is an article from the newspaper, just like 3 weeks old. ETH is experimenting with operating people in different countries. That's scientific level. That's not market level where we can actually roll out IoT use cases. So we've gone and we have looked at where could we help basically the healthcare sector and the healthcare facilities to use IoT, and where could it play an essential role for them based on technologies that we have today and based on their level of IoT readiness that they have, because most of them are definitely not on the case where they are doing operations in Hong Kong. Just to give you the example in Switzerland on how big that market is that we talk about, they have roughly 280 hospitals there. They have about 34 billion in operation costs per year. They have about 180,000 people employed, and a case that we will have a look at in detail, about 40,000 beds all over the place. So quite a big market, but we see not really IoT ready on one hand, and on the other hand, a lot of potential. So we've gone in there and we found quite a few use cases in housekeeping where we believe that they can actually reduce costs, they can improve their operations, such as cleaning, maintenance, operating expenses generally, waste management, and bed line exchange. It's cases that you might not see for the first time, but those housekeeping guys are usually not the ones that are very digital fond or fond of digital topics. But we've actually successfully rolled those cases out in quite a few different hospitals, and I just want to show you very practically what we did. Here is the service and demand case in a few hospitals that we've done over the last years. This here is Spital Thurgau. That's a rather small hospital, cantonal hospital in Switzerland, so cantons is a region in Switzerland. They have about 30,000 patients a year. They have about 4,000 employees, 2023 last year. And the case that they've actually built here, you see the button board up here, and they've rolled out in the whole hospital, is the case I already mentioned before. They simply have a button, basically, they press if they need new bed lining. So the case of that is basically, the guys are in different departments. They have people who soil the bed, and they have no control over going to the basement and getting fresh bed linens. So actually putting a button there has saved us a lot of different calls. It has also saved them the whole process of communicating with the basement of just sending up fresh beds or sending up fresh bed linens. Then the second case here is Spital Zollikerberg. That's actually one in Zurich. Sorry, their design looks very, very ugly off the button board, but the same case that you've seen before where some guys order bed linens. What they actually do is they have infectious waste. So the case that they have is actually, you see it up there, they have a blue bucket that is for infectious stuff. They have a black bucket that's for needles. They have a yellow button, a black button, sorry, the one in the middle is yellow. They have a black thing where they put the rest of the medication in. Someone has to collect that stuff. So they have actually had quite an increase in operational efficiency if they don't have to go and look if this stuff is actually filled. So very simple case. It's a configurable button board here from a Swiss provider. It's a LoRaWAN board. You can just basically print a piece of paper so they can define their own use case. They have done it on their own, so they printed, I want to have bed lines. That communicates over LoRaWAN. Goes into the platform and then basically creates an alert on the other side for notifications for those bed orders, for those medical equipment things. You can see that this case is very low tech at this point. It's also quite singular, but it allows them also to be creative and to start actually finding out what kind of cases do they want to build with service and demand. Here's the next one that we do, occupancy monitoring. This is the Kantonsspital Graubünden. You see again a Kantonsspital, about a bit bigger than the other one, but similar in size, just Swiss regions as they are. Big case here is, should we build a new building or not? So is the hospital big enough or not? And most of the space they use in the case that they build on that case here is actually measuring examination rooms and measuring office spaces and defining, are those rooms actually used in a way as they should? So on what days do we actually have peaks on occupancy of that building? Do we always have peaks on occupancy of that building? And where can we actually reduce the stuff that we have? Similar case, Zucker Kantonsspital. Those guys here are actually using occupancy monitoring again for housekeeping. So what they have is they have those rooms for doctors and nurses that work overnight and might take a nap in them or not. Nobody knows if someone actually used the room or not. So are they going to sleep or are they not going to sleep in that room? What you see up here is actually the room is occupied, so someone is sleeping in there. You see the room has not been used, so I don't need to clean it. And that over all those picket rooms that they have over the place, so they actually know where they have to go and do something that day or not. Again, a cleaning case on that case here. That's something we do with a partner. That partner is called Super. They have a smart cleaning software. So the software defines on what rooms have been used and what rooms have not been used. Also here you can see a lot of LoRaWAN motion sensors, actually from a company that's also here in the room. Jenny's somewhere back there. Simple sensor, you know it from the toilet when the light goes on. So it's a device that measures has someone been in the room or not, goes into the platform, and goes out, in that case here, into the smart cleaning application that actually defines where those guys have to clean. That's St. Gallen. I think they're rolling out the 5th building this year of that, so pretty successful case. So as you can see, there is a lot of applications that we start building. We're starting to build them. We're still somewhere, hopefully not anymore, as Lilian mentioned it before, in the pilot phase. We're actually in the operational phase with those kind of things. But I believe that here we create IoT cases for a group of people in a highly efficient environment that actually can profit of that. And of course, we can grow into all kind of different alerts and notifications and solutions from here. That was my presentation. Thank you very much, and have a good lunch.
Jonas.